morning all. Yeah. So today we will discuss regarding the first part of adult resuscitation or basic life support. So we should always understand what is basic life support first. Then from basic life support, after providing adequate CPR, the next step comes is the advanced cardiac life support. In the previous class, we have discussed regarding the chain of survival. What are the components of the chain of survival? So, what are the components we have already discussed? The first one, we have an out of hospital cardiac arrest and an in hospital cardiac arrest. So, both we have discussed. Now, we will go into basic life support. So, what do you mean by basic life support? So, that is the first question. Basically, it is a combination of rescue breathing and chest compression delivered to a victim of cardiac arrest. So you can see here, it is a combination of the most important terms here is the rescue breathing and chest compressions delivered to a victim of cardiac arrest. So basic life support means you are giving rescue breaths. The patient is not breathing, so you have to give rescue breaths as well as you have to give compression because the heart is not functioning at this point. So you are compressing the heart between the sternum and the vertebra, and you are giving a pressure so that some amount of blood is reaching to the vital organs like brain. So that is the most important thing. So what we are looking here, it is we are giving a combination of rescue breathing and chest compression for a victim of cardiac arrest. So that is what we meant by basic life support. Basically, what does it do? It delivers a small amount of blood flow to the heart and brain to buy time. So you have to understand that the heart is not functioning properly. So we want to buy some time till the heart is recovering so that the heart and brain is not having oxygen supply during the cardiac arrest time. By giving compression, some amount of blood is reaching to the heart. So that is the most important thing that you need to remember. Okay. So when you call basic life support, the combinations are you have to take care of the circulation, you have to maintain airway and breathing, and we are not using any other equipment than a protective device. Ideally, we are not using any other equipments. We are just giving a bag mask or a mask or a mouth-to-mouth respiration, or if you have an AED or a defibrillator available, we will connect to the patient. Suppose you don't have any AED or any defibrillator, we will be just continuing giving compression and rescue breath. So we are not using any other major equipments and no drugs has been used in BLS. So when you start using drug, we will call it as advanced cardiac life support. So basically, you have to remember that what do you mean by BLS? Basic life support. Basic life support, a combination of rescue breaths and you are delivering a chest compression to a victim of cardiac arrest. What is the role of BLS training? What is our idea? You have to recognize that a sudden cardiac arrest. A patient is having a sudden cardiac arrest. So you need to identify that is a sudden cardiac arrest. And you have to know what are the common signs of heart attack. When somebody is complaining of chest pain, you should understand that it is a sign of heart attack and stroke and foreign body obstruction. So these are the very important part that you should understand when you are dealing with basic life support, and you should know how to do a proper cardiopulmonary resuscitation. So proper CPR. CPR, I am not emphasizing here, it is high quality CPR. Again and again I am telling it should be high quality CPR. So high quality CPR, we will discuss that when we come to the next part. And if available, you can use a defibrillator or an AED. So defibrillator and AED, what is the difference? Defibrillator, you have to recognize the rhythm and you have to see whether it is a shockable or a non-shockable rhythm. But in AED, it automatically detects whether it is a shockable or a non-shockable rhythm and it tells us whether to deliver shock or not. So that is the basic difference between an AED and a defibrillator. So you have to understand this difference. So the moment a patient is collapsed in front of you, so a patient has collapsed in front of you, you can see a patient here. The first thing that you have to do is that you have to tap the shoulder and you have to check for response and simultaneously you assess for breathing. So what you have done here, the person has been collapsed in front of her and she's going and tapping the shoulder and seeing and asking whether are you okay. So that is the first step that you need to do. So after doing the first step, what is the next step that you need to do? The next step is immediately you have to call for help. So you will not be enough alone, because inside the hospital you will have a lot of people, but it is happening outside the hospital. Definitely it is difficult. So you have to call for help. You have to call the ambulance services or nearby hospital or your colleagues, and you have to get for help. So that is the next step. So immediately you have seen that somebody has collapsed in front of you. The first step, what you have to do, you have to verify the scene is safe, and you enter to the scene and check for the response of the victim by tapping over the shoulder and simultaneously assess for the breathing. We'll see the algorithm in the last. What are the 3 types of patients that you can have after this, that we'll see in the towards the end of this class. And next is you have to call for help. Alone will not be enough. Then the next, you have to start preparing the victim to start CPR. So preparation is very, very important. The victim has to be on a hard surface. Suppose the patient is in the hospital, you have something like a board like this. You can, what we call it as CPR board. We can keep beneath the patient, underneath the patient, and you can start giving compression. Otherwise, what will happen? If you are giving the compression, that effectiveness of the compression won't be there. The compression, when you are giving the compression, what will happen? The force, whatever you are transmitting, will transmit to the bed. It will not go into the patient's chest. So you have to place something like a hard board like this. The victim is already on the floor, that is fine. You can start giving the compression, and the victim should be supine. That means the patient should be lying on his back. So that is the requirement. If the patient is onto the side or something fallen down, you have to make sure that the victim is supine. So CAB, previously it was ABC, now it is CAB. So the priority number 1 is circulation, airway and breathing. So first most important thing you have to concentrate is on compression. Giving compression, then only it will come is the airway, maintaining the airway, then only the third one will be breathing. So it is CAB of CPR. So you have to remember it is C, A and B, not A, B, C. This is not the one. So you have to remember A, B, C, that is for your patient that you are resuscitating in the ER. But when you are doing CPR, the priority is for circulation, that is compression, maintaining the airway and adequate breathing to the patient. So that is the CAB of the CPR. The next one, first coming to the circulation. So first most important thing that you have to remember is that you have a patient here who has been unresponsive and you have called for help. That is the scenario. Now you have to confirm that whether it is a cardiac arrest or not, because all the unresponsive victims are not having cardiac arrest. So you have to confirm it whether it is a cardiac arrest or not. So to know whether the cardiac arrest is not, you have to do the pulse check. So the pulse check should be done over the carotid artery. So either to the right or to the left, but make sure that whenever you have a patient, many people are there, don't simultaneously palpate right and left together. It should not be done. Either right or left. Because what will happen? Already, suppose, imagine that the patient is not having a cardiac arrest. The patient might be having a stroke. There is already some flow, decreased flow to the brain. Already happening. You are going and compressing both the side of carotid. What will happen? Again, the blood flow to the brain will decrease. So don't check for both sides, either right or left. Whichever side of the patient you are, that will be more comfortable for you. Suppose you are on the right side of the patient, check for the right carotid pulse. This is the location. You see the front prominence will be there. In males, we can call it as Adam's apple. And you go to the side, either to the right or either to the left, where you will have a small groove like this, and where you will keep the hand with the 2 fingers. There will be, you will be able to palpate your carotid pulse. When you are doing the carotid pulse, you should not be taking more than 5 seconds, and minimum 5 seconds you need to examine. So minimum 5 seconds and not more than 10 seconds. So that is the most important thing that you need to remember. Minimum 5 seconds, not more than 10 seconds. Next, where we should give the compression. So that is very, very important. So the most important thing, as I told, the victim should be on a hard surface. That is very mandatory requirement. And identify the lower half of the sternum. Suppose this is the chest cavity. There will be a sternum bone. So this is the area, lower half of the sternum. So lower half of the sternum, and depress the sternum at least 2 inches or 5 centimeters. So that is the depth, how much you need to give the compression, at least 2 inches or 5 centimeters. And also you have to make sure that while giving compression, you are giving adequate recoil for venous return. So while you are giving compression, you have to give time for recoil also. Otherwise, what will happen? There will not be any refilling of the blood into the heart. So you have to make sure that you are giving adequate recoil for venous return, and you have to go with a compression ratio of 30:2, and 30:2 is one cycle of CPR. That remember that 30 compressions followed by 2 rescue breaths is what is called as one cycle of CPR. One cycle of CPR. So you have to remember one cycle of CPR means 30:2 is the compression ventilation ratio. Then the next, this is what I have told. You have to, this is the lung, what you are seeing here. This is the sternal bone, and you have to identify the lower half of the sternum, and in the center, this is the area where you need to give the compression. So this is the area where you need to identify. It is not in the left, not in the right, it should be in the center of the chest. So this is the area where you need to give the compression. So you have to remember this. So now coming to the hand position, how you should keep the hand. There is another important thing that you need to remember. One thing, you can keep one over the other, or you can interlock like this. These are the two methods by which, one, you can keep one over the other, or you can interlock your hand. So these are the two acceptable methods. So both is okay, but whichever is comfortable for you, you can do that. Okay. The next one, how to give compression. So you remember that you have to give a compression to the patient. So suppose this patient is lying on the floor, make sure that you are leaning towards the patient's chest, and make sure that your elbows are straight, and your movement should be from the hip joint. Your movement should not be from the shoulder joint. What we are trying to do, we are just trying to transfer our body weight to the patient's chest. So this should be the ideal position, and you should be this angle, whatever be this angle should be, you should be perpendicular. This angle should be perpendicular. It should not be sideways, it should be over the patient's chest. So very, very important, and movement should be from the hip joint. So fulcrum, you know, in a joint there is a fulcrum. So fulcrum is where the movement happens. So this part is a single unit, and only the movement should be coming from the hip joint. So that is a very, very important thing, and make sure that the elbows are straight while you are giving the compression. You can do it on the right side or left side, whichever side you are comfortable with, but make sure that you are doing it in the center of the sternum, that is the lower half of the sternum, center of the sternum, and the movement should be from the hip joint. Very, very important. You need to remember this. And so the moment you are giving 30 compression, you need to give rescue breath. Suppose you are alone, you don't have any other device, you give compression, you give rescue breaths. 2 rescue breaths. Suppose in a scenario where you are having dilemma, we have COVID, so we are not very comfortable to give mouth-to-mouth respiration. We don't have any barrier devices with us. So what you need to do, you need to give compression at a rate of 100 to 120 compression a minute. So what we have discussed now, we have done is the compression. Now we have to know what is the high quality CPR. What do you mean by high quality CPR? So the high quality CPR comprises of first one, rate. Rate at which you need to give compression. Rate is, what is the rate? It is 100 to 120 compression in a minute. To be very clear, it should be 100 to 120 compression in a minute. So that is the first quality of CPR. And second quality of CPR, depth should be 2 inches. While giving compression, it will be 2 inches, or it should be 5 centimeter. And next thing, what you need to remember? Next, what you need to remember is that adequate recoil. You are giving adequate recoil. And what is the fourth one? Avoid excessive ventilation. So excessive ventilation should be avoided. Avoid excessive ventilation. And final one is what? Minimize interruption. So we have to minimize interruptions. So we have to minimize the interruptions. So minimize interruptions also. If at all any interruption that is to be done, that should not be more than 10 seconds. So suppose you want to do a pulse check, you have to do it not more than 10 seconds. So that is what you have to remember. So you have to high quality CPR, rate 2 inches or 5 centimeter, recoil, avoid excessive ventilation, and minimize interruption. So these are the things that you need to remember. So now coming to the next one, airway. So airway, you see here, this is a very important diagram. You see here, when a patient is lying down normally, what is happening? This is the airway passage. You see, this is the airway passage, right? So this is the airway passage, and what is happening? The airway is not patent here. Why? Because the tongue and the soft tissue is coming and obstructing the airway. See the dotted lines here, this dotted black dots, see, so there is no continuity here. So this air will not be passing. So in order to open up the airway, you have to do a manual called as chin lift and jaw thrust, or head tilt and jaw thrust, whichever maneuver you are using. You have to lift up the chin and you have to tilt the head so that the airway patency is maintained. See here, there is airway is closed here. Now by doing a chin lift and a head tilt maneuver, the airway is opened. So that is very important. You have to do a head tilt and a chin lift maneuver. Suppose you are having a patient with suspected cervical spine injury, you will not be able to do a chin lift. You can do head tilt. You should not be doing. So head tilt maneuver you should not be doing. Instead of that, you need to do something called as jaw thrust maneuver. Basically, you have to grasp the angle of the lower jaw and with both the hands on each side move the jaw forward. So you are trying to open up the jaw so that the airway patency is open. So this is the pictorial representation. So we can have a demonstration in the mannequin later on. Next, coming to rescue breaths. Remember that rescue breaths delivered should be over 1 second and give sufficient tidal volume to see a visible chest rise. But sometimes in adult patients it is difficult to see a chest rise. But in pediatric age group you will be able to see a chest rise. But ideal thing, you should be able to see a chest rise and avoid rapid forceful breath. So like that you should not be doing. It should be, you have to give back mask ventilation. If you have back mask ventilation, each breath should be delivered over 1 second. Suppose it is a mouth to mouth respiration. This is the way by which you need to give mouth to mouth respiration. Suppose you have a barrier device like a pocket mask, you can connect to that pocket mask and you can deliver each breath over 1 second. So that is most important thing. In the presence of an advanced airway. So advanced airway means suppose the patient is already intubated or you have inserted an LMA, there is no need of this 30:2. 30:2 is not needed. You just continue compression at a rate of 100 to 120 per minute and every 6 seconds you deliver one breath. Suppose this patient is already on a ventilator, connected to a ventilator or you have put an LMA, there is no need of 30:2. You can just continue at a rate of 100 to 120 compression in a minute, and what you have to do, remember, is that you have to every 6 seconds you have to give one rescue breath. Clear? So there are different methods. So mouth to barrier, mouth to nose or stoma, bag and mask, which is what we commonly use, and advanced airway. So these are the different types that you need to remember. So one cycle, remember that it is 30 compressions followed by 2 rescue breaths. That is one cycle. So approximately after 5 cycles, that is approximately after 2 minutes, you will be reassessing the victim. Suppose this patient is having a cardiac arrest, you have to reassess the victim after 2 minutes. When to stop resuscitation? That is the next question. When to stop CPR? When patient shows signs of life. What are the signs of life? We have got a palpable pulse. After 2 minutes of CPR, you are getting a palpable pulse. Then you can think of stopping the CPR. Or when a qualified medical help arrives, you have a different team that you can hand over to them. You can think of stopping the CPR. And when the BLS provider gets exhausted, but it is very unlikely in our scenario. But this is what you need to do when you have a patient with when we have a patient with cardiac arrest. Next, the moment a defibrillator. So, for example, in a hospital, we can get an AED or a defibrillator. The moment you get an AED or a defibrillator, without interrupting the CPR, you connect that to the patient and see whether it is a shockable rhythm or whether it is a non-shockable rhythm. Depending upon that, you deliver the shock. Okay, so we have to decide whether it is a shockable or non-shockable rhythm. So again, this is the most important algorithm that you need to remember. So this is the cardiac arrest, basic life support algorithm. So first of all, as I showed, verify scene safety and check for response, shout for help and activate the emergency system. Get an AED. If you have an AED, you get an AED and you see what? Look for breathing or gasping or do a pulse check. So at this point of time, you can have 3 possibilities. You can have a patient who is breathing well and also there is a pulse. The patient has collapsed in front of you, but the patient is breathing as well as there is a pulse. So what do you need to do? Just monitor until the emergency responder arrives. Monitor the patient, keep on a left lateral position because aspiration chances will be low. So that is the only thing that you need to do. Keep the patient on a left lateral position. So moment an emergency help comes, you can hand over the patient to them. So what is the scenario? The patient has become unresponsive and he has collapsed in front of you. You have activated the emergency response. You have called for help. You have checked for pulse and breathing. There is pulse as well as breathing. He is not in cardiac arrest. So just keep the patient on a left lateral position. That is the first thing. Next thing, the patient is having pulse, but he is not breathing well. Patient is having pulse, but he is not breathing well. If the breathing stops, he will go into a cardiac arrest. So breathing has already stopped. So the patient is not breathing and there is palpable pulse. What do you have to do? You have to do back mask ventilation. So you have to give rescue breaths every 6 seconds or 10 breaths per minute. And every 2 minutes you need to check for the pulse, whether the pulse is there or not. So two scenarios we have told, there is pulse and there is breathing. You keep the patient on a left lateral position. Second scenario is what I told, there is pulse but he is not breathing well. So just give back mask ventilation. And finally, where is the scenario? There is no pulse, no breathing. So what do you have to do? Start CPR. Start CPR and you perform 30:2 compression. Whatever high quality CPR we have mentioned, you continue to do that. And moment an AED arrives, you connect to the patient and see whether it is a shockable or a non-shockable rhythm. And it's a shockable rhythm, deliver the shock and continue CPR. If it is a non-shockable rhythm, continue your CPR. So how long you need to continue the CPR? Till there is a signs of life or an expert team comes up and ACLS has been started. Like you have to start the patient on drugs, you have to take care of the airway, maybe advanced airway, look for the causes of cardiac arrest. So this is in a nutshell what you have to write when a question is asked regarding basic life support. So basic life support, you have to write these many things. So not just giving compressions, word to give compression. What is the role of BLS? What is exactly meant by BLS? Word to give compression. What is the rate of compression? What is the quality of CPR that we are mentioning? High quality CPR. What are the three possibilities that we can have in a patient? This algorithm, whatever we have discussed right now. Whether the patient is having a pulse and breathing, whether there is pulse and no breathing, whether there is no pulse and no breathing. So this is pretty simple. So whenever a question arises on this thing, you have to go ahead with this algorithms. Okay.